guys, welcome to this week's Dermatology Flash Briefing. This episode is brought to you by Dermadry. Their iontophoresis machine is an all-natural, non-invasive, needle-free and drug-free treatment option for palmoplantar and axillary hyperhidrosis that has revolutionized conventional hyperhidrosis treatment. Now to begin with, we're going to be talking about hyperhidrosis. Hyperhidrosis is the medical term referring to the condition of excessive sweating. This can occur over the palms and the soles, and also areas of skin folds known as the flexures, such as the axilla, under the breast, and the groin area. When it occurs on the face, it is known as facial hyperhidrosis. Now, these are the areas where sweat glands can be the most active. Some issues associated with palmoplantar hyperhidrosis in particular would include social embarrassment, difficulty with certain activities such as writing in cases of severe hyperhidrosis because of excessive sweaty palms. The key thing about palmoplantar hyperhidrosis is that it can significantly interfere with activities such as playing sports, for example, racket sports. One may find it difficult to hold on and to even grip the racket. This can also be the case for ball games, leaving wet patches on the steering wheel or on the keyboard, or even in a casual social setting. It is embarrassing having to shake hands when your palms are excessively sweaty. For school-going children who may have to write for routine homework and especially for exams, this can be debilitating as the wetness can cause difficulty in gripping pens and even cause smudged, illegible handwriting. If your job requires direct contact with instruments, or in the case of a kitchen worker, it could even be dangerous because lack of grip when using knives can cause accidents. Now, we have seen how excessive sweating, especially of the palms and soles, can significantly interfere with activities of daily living. But what I wish to highlight as a dermatologist is that it can also cause the individual to be extremely self-conscious, a source of chronic social embarrassment that can affect one's psychosocial well-being and quality of life. Unfortunately, this is a vicious cycle. The ensuing anxiety of having palmoplantar hyperhidrosis can worsen the condition because of the hormonal regulation that occurs with the sweat glands, leading to a self-perpetuating cycle where one is anxious about this condition, a state that brings on the symptoms even more. Also, the accumulation of sweat in a tropical humid climate, for example, can worsen the growth of bacteria, and this predisposes to certain skin infections such as the flexural areas due to the bacterial skin infection known as corneobacterium. When this occurs over the axilla, it is known as erythrasma. Pitted keratolysis is a condition affecting the palms and soles, presenting as little pits on the skin, which is due to bacterial infection and is associated with palmoplantar hyperhidrosis. Individuals with excessive sweating may develop eczema because of the persistent moisture, especially in tropical humid climates. This can cause skin irritation. When it occurs over the skin folds, it can lead to a condition known as intertrigo. Hyperhidrosis is also a risk factor for bromhidrosis, the medical term for body odor. This is due to accumulation of moisture in a humid, occlusive environment and subsequent bacterial proliferation. This is also socially embarrassing. Moving on to treatment, individuals who have palmoplantar hyperhidrosis are often under the care of a dermatologist. The first-line treatment is usually with aluminum chloride-based topicals which aim to reduce sweating. One of the biggest problems associated with it is skin dryness, especially an issue with those who are suffering from hand eczema. Even those who do not have eczema can develop hand and feet eczema after using aluminum chloride topicals for hyperhidrosis. One of the most effective interventions for palmoplantar hyperhidrosis today would be tap water iontophoresis. However, as this is usually conducted in a dermatologist's office in terms of the procedure, there is significant non-compliance and lack of effectiveness. Dermadry has developed a home-use iontophoresis device that reduces the activity of the sweat glands with regular treatment. That has been proven to be effective in the treatment of palmar, plantar, and axillary hyperhidrosis. The difference of tap water iontophoresis being conducted as an in-clinic treatment versus a home device lies in the convenience, accessibility, and ease of use in the latter. This directly translates into compliance, saved costs, and overall better disease control. This can improve psychosocial well-being significantly in an individual who's suffering from hyperhidrosis. In a study published in the Journal of the Canadian Dermatology Association, it was found that patients with palmoplantar hyperhidrosis were non-compliant with tap water iontophoresis primarily because of the inconvenience and lack of time. The recommendation of the dermatologist involved was to encourage them to have a home device for maintenance. Dermadry is a solution for excessive sweating of the hands, feet, and underarms, the three zones most commonly affected by hyperhidrosis. Their home-use device is able to control hyperhidrosis symptoms in as little as a few treatments. Each session lasts between 15 to 20 minutes and can provide up to 6 weeks of dryness at a time. An easy-to-follow treatment schedule must be maintained, and their user-friendly instruction manual even lays out the treatment schedule for you according to your level of hyperhidrosis. Additionally, Dermadry is a very compact and portable home-use device that can be conveniently used and stored away. Dermadry can easily be incorporated into your schedule as part of your daily or nightly self-care routine, or it can be used while watching your favorite show, reading a book, or simply relaxing. Their home-use iontophoresis device improves patient compliance, overall well-being, and quality of life, and reduces the need for in-person visits for iontophoresis treatments. Overall, it is a cost-effective and efficient treatment option for a chronic disease that affects millions of people worldwide. Well, that's it for this week's Dermatology Flash Briefing. Find out more about Dermadry by visiting their website, dermadry.com, and following them at Dermadry on Instagram. Thank you guys for listening in. Until the next episode.